Almost 250 million Africans could become infected with COVID-19. This is according to a new modeling study by the World Health Organization. There are concerns over the readiness of healthcare systems on the continent to handle mass infections. In the midst of the pandemic, Burundi has expelled the top WHO officials in the country days ahead of key elections.
A new study by the World Health Organization has found that up to 200 million Africans could be infected by the coronavirus. The study further says that unless action is taken, as many as 150,000 people in the continent could die. There is also a concern that countries' health systems won't be able to handle mass infections. Even with the 27 recorded infections and 1 death, Burundi expelled a World Health Organization team in the middle of the pandemic, just days before the presidential elections. The government gave the 4 officials a few days to leave the country over what they termed as unacceptable interference. The announcement came amid low testing for COVID-19 and few precautions against the disease. Authorities have downplayed the seriousness of the virus and allowed public gatherings like mass election rallies in contradiction with World Health Organization recommendations. Burundians will choose a new president, parliament, and local officials on May 20th. A Ugandan wildlife sanctuary is appealing for funds as it only has enough money to feed its animals until June.
We have had a shortfall of $400,000 as a result of the lockdown, which was basically supposed to come from the visitors. And since we closed down, that implied that that income is not coming in.
No visitors have been to the Ugandan Wildlife Conservation Education Center since it closed in March, but the animals themselves are thriving in the quiet, finding it much easier to breed. And as Angola reopens its operations, one neighborhood in Luanda remains isolated after several residents were diagnosed with COVID-19. Angola has so far recorded just 43 cases, including 2 deaths. In Senegal, engineering students have invented automatic hand sanitizer dispensers and medical robots.
We realized that in Senegal, at least in developing countries, medical equipment to protect health workers was limited. Since the workers are on the front line of the fight, the idea is to protect them so that they can protect and lead the fight against the pandemic.
From the engineering school in Dakar, they have turned their technical skills towards easing pressure on wards, and they are already in talks with hospitals.